Minister. I see Vice Minister and members, partners of the chambers. Hello, welcome to this meeting. It is a pleasure to welcome you here in a members' business meeting with the Minister of Health, Mr. Dulkys. Myself, I am Dalia Tamashauskaitė-Žilienė, partner at TGS Baltic, head of Healthcare and Life Sciences Industry Group, and I will be moderating this event. Before we kick off and I give the word to the Minister, a couple of technical matters. So I would like to remind you to mute the microphones who is not talking. The meeting is scheduled for an hour, so we have to be effective and sharp, I believe, to respect the Minister's and his office's time. We will start from a short presentation by the Minister, and afterwards we will be able to ask some questions. Thank you for those who have already presented the questions while registering for the event. For others who did not have an opportunity, please use the chat function, and I believe we'll try to answer as many as possible. So this is short from me, and then Minister, please, can I invite you?
Okay, thank you very much, and I would like to sincerely thank you for this opportunity to be with your community, very interesting community, and to be somehow to be included in your community's life. And now all our life is like marathon. Yeah, and the events and meetings chase each other, especially on possibilities what is giving for us from IT, and these possibilities to participate in a lot of different meetings online. And I'm not sure that it's good for our health. But okay, let's see what we can do today. And okay, maybe first of all, maybe I will share with you a few slides with information about pandemic and what we have at the moment, and a short summary about the tendencies what we have, for example, from December to today. Now, okay, I'm trying to, okay. Okay, I hope that you see my slides.
Yes, we see them.
Yes, okay. First of all, it's like in a book of Thomas Mann. It's a mountain of our problems, and you see on the top of the mountain we were somewhere in the middle of December. Lithuania at that time was on the top. It's of course it's not a championship, but we on the top of all problems in the context of pandemic and around the world and around the Europe. And you see, we had about somewhere maybe in the second part of December, we reached about 1,500 cases, and it was the biggest number, as I said. Now our colleagues from Estonia, from Czech Republic are on the same situation. And but what is good that today we reached about 270 cases per day, and of course the fall is shorter than was the rise, but we a little bit now stabilized, and we have not so good news because we see how evidences rise. Okay, if we compare the situation in December and now, of course, prevalence in December in left, and today we see that in right that Lithuania cleaned up, if I can say like this. If when we are looking at this picture, we see that from European leaders, as I mentioned, we went to the bottom of the line, and in this picture is 7-day cases average per million population, and as I mentioned, Estonia is where we were in December. When we are talking about the deaths, again from European leaders, we now went to the average by death. If we look at this picture, you see this mountain, this special mountain. That means that more people died during the pandemic period than in any other year in the last 2 decades. I would like to repeat, in the last 2 decades. And most of them during the second wave of the pandemic. And you see this excessive mortality is drastically reduced today. And it's our society reached this result. This is another point of that you see in this picture, that the reduction in excess of mortality was due to concrete reduction in direct and COVID-related deaths. Again, the same red mountain. Another one very important issue is situation in hospitals, and there now the similar situation what we had in the middle of December. Now you can see for example, in France, in Paris, in Paris hospitals. At that moment, we had about 95% of hospitalization, and our system was almost overloaded. And there are currently 3 times fewer patients treated, and there are 3 times fewer COVID beds than were in December, January. And even when the situation in the hospitals was very serious, and we were balancing on the verge of collapsing of system, we made a few decisions that made the work of the hospitals easier. First of all, we enacted the provision that medical services for patients with COVID hospitalized could be provided by other specialists. At a time when there was a particular shortage of staff, we decided to allow other personal healthcare professionals to perform the functions of nursing assistant, for example, biomedical technologists, dieteticals, occupational therapists, pharmacists of advanced practice, massagers, medical geneticists, medical psychologists. Second very important measure was that we have shortened the isolation period for personnel in healthcare system by providing additional testing, and that's allow for managers to assess each case individually and safely shorten this period. And the third very important measure was that in order to save beds in the COVID wards, a decision was made to continue treatment in rehabilitation hospitals for stable patients. And that was very good measure, and we saved our healthcare system. And of course, very warm words are going to volunteering in hospitals in collaboration with Caritas, the Red Cross, and Maltese. A regular volunteering process has been launched in COVID wards of hospitals, and that's was very big help. When we started when we announced our pandemic plan, we informed society that if we want to return to the situation when we are trying ourselves to drive our car, but not by help of the virus, that we should achieve these KPIs. And of course, it's a very important, urgent clarification of cases. That means all persons who experience the symptoms of disease are given the opportunity to test both after referring to a doctor and after registering by a special phone number and arriving to the mobile point, which were established in all municipalities. It's very important, of course, isolation of these peoples. We introduced traveler control. Of course, it's currently recommended to postpone all unnecessary travel. But if this cannot be avoided, of course, engaged control of travelers was when you are arriving in Lithuania. The person must have no earlier than 72 hours prior to the trip test, and of course isolation. Okay, it's like this picture. It's shows for us. It's like our trip. You see, it's and then nearly a third of municipalities and a fifth of the population achieved our targets, and we used different quarantine measures for that. And later we will have possibility to talk about this a little bit if you will see a need of that. Of course, and the main thing it's not restrictions, but of course the future of our societies, not in Lithuania, but overall is the strategy of testing and the number of tests performed daily, you see, decreased. But it happened because the main reason for this was the decline in testing directly related to morbidity. That means that testing for symptomatic were bigger when our society was ill, but when we solved a lot of problems, the symptomatic testing decreased, and that's opened it for us possibility to start a new a new strategy. That means prophylactic testing, and that's very important. That means that that we are going again the virus into concrete fighting the virus, and the scope of prophylactic testing has been expanded to identify as many individuals as possible who may be infected by coronavirus. And that's allow persons resuming their activities after quarantine to be tested in order to ensure the safe provision of the resumed services. The composition of preventing testing, you see, changed. With the decrease in preventing testing of doctors and nursing homes, we have the opportunity to test other groups in contact with people at mobile points. We vaccinated a vast majority of healthcare system community, and you see there it's this red color. This red indicates a decrease in morbidity after vaccination. You see how better results are when community is vaccinated. And since December, the number of preventing testing groups has been expanded. And periodic testing of these groups has started weekly, and opportunities have been created for directors of municipal administration to involve additional testing groups in different municipalities on the basis of their epidemiological situation. And there you see how that means that we actively started using other types of tests. Rapid antibody tests saved, for example, a lot of vaccine doses without vaccinating people who had already been cured from COVID. We started to use and increase the scope of testing with rapid antigen tests, and expanded the testing possibilities with new methods of pooled tests and other things. Now we are working on rapid test purchase scheme, and this scheme is developed. Parallelly, we are working on dynamic purchasing system of for COVID laboratory tests. And robots are coming to our labs. And to summarize, that means that it's like transition from passive to proactive testing strategy. And in the event of morbidity rate decrease in the country, the efforts of public health professionals are now focused on the management of outbreaks. And it's a very important moment. Now, a few words about vaccination, you see the portfolio of vaccines which are reserved by Lithuanian government, and we had when we started our activities in the middle of December, we had only 2 weeks to prepare vaccination in Lithuania, and we developed in 15 days, we developed a process for planning for necessary measures for vaccine and vaccination. We developed a vaccination plan. We developed the Pfizer vaccine cold path movement schemes for vaccines. We established the vaccination procedures in municipalities. We enabled the municipalities to organize the vaccination process in response to the needs of particular municipality. And later, if you will have questions, we will talk more about this. Now we are working on new plans, and this weekend will be first when we vaccinate on weekends. In future, we are working and want to include pharmacists in vaccination process, and vaccination at the mobile points is being considered, and a lot of other measures. And you see that, of course, Pfizer and Moderna vaccines is more popular, and AstraZeneca have its own problems. And later I will be ready to answer to your questions about Astra, if you will have. Okay, there you see that vaccination is, of course, it's the biggest goal now is to vaccinate, of course, as many people at risk groups and as soon as possible. And of course, this process is closely related to supply of vaccines, the quantities we received, and as well as the communication of possible adverse reactions or people's beliefs about the vaccines. And vaccination of risk groups are now gaining moment after vaccinating doctors and care home staff, and we are moving to other groups, and we have open data where everyone can see the real situation. Okay, it's maybe a little bit not newest, but in any case, when we are looking at all EU countries, Lithuania always is somewhere in the 7th, 6th, or 5th place among other states, member states in EU, regarding the administered doses of vaccines. But of course, the main question is not a championship, but the main question is that we all of us need more vaccines in the future. Now, a very important moment is, of course, it's detection of the new coronavirus mutations. And the detection of new viral mutations is a new challenge that raises concerns about easier and faster spread. And in Lithuania, mutation monitoring system was introduced, and I'm happy that it was done in very short time. But we are not happy that that the tests are performed both in Lithuania and in other labs of EU. Shows that in Lithuania we have a British mutation, and it's bad news, especially for Vilnius and Marijampolės districts, and that's a very, very, very serious moment. There you see that I mentioned only Vilnius and Marijampolė, but it seems that the virus, this concrete strain, will spread among all Lithuanian territory. And on the right, you see what happened in Denmark. That means that this new mutations they are spreading very, very soon, and it's forecast that in 2-3 weeks we will have this new mutation in all Lithuania. That means that the epidemiological situation in comparable better than during the peak in the winter, yeah, when we were the leaders of Europe. Now we are controlling excess mortality, investing in new testing methodologies and tools. But situation can be dramatically changed by new strains of virus, and therefore I should note that the testing is currently our the biggest weapon, of course, and vaccination against outbreaks and the spread of disease. And we often talking about the 2 waves and our experiences, and please look how looks the first wave. It's like only a point. It's very difficult to see, and what means the second wave, and that means that we sometimes can't compare the measures among these two situations. And to summarize, that we have we will have difficulties, I think, in 3 weeks ahead of us, and mobility is one on the rise in 2/3 of EU countries. In Estonia, from the March of 11, strict quarantine has been introduced. As mentioned, in Parisian hospitals is as tense as it was in Lithuania in the mid of December. In Poland, the infection of the British strain reached 50-60%. Supermarkets are being closed, and there is already a lack in hospital vacancies in the region. And of course, at the moment, Lithuania is among the 8 EU countries where situation is better, but to be frank, it's only relatively. It's not because it's is getting better, but because it's getting worse elsewhere faster. And even in 40 municipalities, the number of cases is growing again. Hospitals, as I mentioned, is filling up, especially in Vilnius region. British strain of virus beginning to take root, and of course now the virus is trying to occupy all our territory. Okay, that's a short picture about pandemic, how I see, and let's try to talk about this and to discuss. And for me, of course, will be very interesting to hear and your opinion, your suggestions, your critique. It's very important for me too.
Thank you very much, Minister. I believe this was a a very good picture for us to see how this developed and where we are. And of course, this improvement that has been achieved within these several months could not have been without the work and all that your team has done. I think what we had some of the questions on mostly vaccinations, vaccination in the pandemic. Currently, as you mentioned, also the vaccination, and there are some problems in how the vaccination is perceived by some of the people. Are there any plans by the ministry how to promote vaccination in principle? And probably we could look at the COVID situation, but maybe this would also, you know, to a certain extent help promote vaccination as the process overall in Lithuania. So do you have any measures planned? Maybe there are some measures allowing people to come back quicker to this normal, if I can say so, life would also help promotion of vaccines.
I think that I'm not trying to say that the critic regarding the communication is not reasonable. Yes, it's very important, and I agree with all critics from the public relations. But what I would like to clarify that we are talking about 3 important moments. The first moment that professionals in this field they are saying that our state, Lithuania, and our politicians is forming the all politic in the health system. They are responsible for decades for education of people, and the problem of to be in opposite of any vaccines is in Lithuania is a problem for years, for decades, and it's a moment that we should have the long-term strategy about all vaccines, not only about the situation with this coronavirus. The second moment, and the second part of criticism is coming from the situation that what we did after the first wave of pandemic, because at that moment where our society have had about the European Commission plans, about coordinating system, about the evaluating and creating of new vaccines, and that means that we had more than 1.5 of the year before the first vaccines came to our country, and the vaccination process I will remember it started in the 27th of December, and there is a second moment, yeah, and we did not so many. And again, as I said, most of you are from private sector here, and I understand that, of course, all of us can work more efficient, but please understand when you are putting your hand on the constitution of the country in 11th of December, and you have information that the first vaccines arrives on 26th of December, and on the 27th December is the morning when in all Lithuania vaccination should start. And please create all system, please all IT questions, vaccines, people, staff, and communication too. It's reality, and we decided to ask help for non-governmental people, and Edmundas Jakilaitis and his team helped for us free of charge, and they worked parallelly 2 months on the start on the to how for us to start this communication. We put our resources on vaccination facilities, on vaccines, on tests, because in 2020 Lithuania have no antigen tests. No, we haven't, and we can't to use a measure of testing, and only in February we started this. That means I agree with critic, and now we are working more and more, and now the vaccination campaign, the campaign of information is I hope you will see more and more things. And what is very important, another one moment, that we had a poll, we had a research, who is authority for people on the questions of vaccination, and to be frank, we saw that the vast majority of people said for them is most important is experts, not politicians. And that means that we are working on the front, on the second, not in front office, but in back office of these questions. And we are doing a lot of job how to create articles and other things on the vaccines, but we are not in front line to people. Okay, I hope that I answered.
Thank you, Minister. I see Arnas Vozbutas is raising a hand, maybe a short question.
Yeah, thank you very much for opportunity to. My first question will be, dear Minister, as I'm representing the AstraZeneca. So, how do you feel after vaccination? Is everything is good and all side effects are managed?
Okay. Yeah, I feel very well.
Okay.
I had only on the second day I have a temperature. It was not high. I had possibility to work all day. It was not a problem, and it's fine. And I have had that a half of ministers have no, they have no bad feelings, and only a few of us had the temperature.
Okay, so it's really encouraging, and honest and personal. Thank you very much for encouraging the science and showing the personal leadership. But my question is related less with the vaccine and regarding vaccination and education for the healthcare professionals, as you said about experts. Please reach us and let's manage how we can collaborate in order to help provide information. But my question is rather it's a little bit separate. In the beginning of the when you started your duties, you mentioned in a few conversations about the state institution readiness for managing this type of crisis, like national public health centers, expertise. Currently, with the vaccines, it's very important also the State Medicine Control Agency expertise and capabilities. What are your thoughts? What we can learn and what you are thinking for the future? How these expert centers, state-owned or not owned, but driven state institutions like State Medicine Control Agency, because they are not only looking for pharmacovigilance system and ensuring safety is managed, but as well they are evaluating the innovation treatments which are coming. And currently there is a huge personal gap in this state agency, and the other problem will come probably in during the summer or autumn, when many innovative tools for other diseases will be not evaluated just due to the lack of manpower and expertise in this agency. Just can you comment on that? What's your view how to strengthening the state expertise of state agencies?
Yeah, it's quite new situation, and for these state agencies, what you mentioned, because their tradition was they were not seen in public life before, but of course now it's a question, and how is working a media? For example, when we stopped. Pfizer vaccines in Lithuania, we stopped twice of vaccination of this vaccine, and it was a question again of safeness, about the problems in the cold path. We are controlling all vaccines, and we are controlling all points in all process. Yeah, and if we're receiving a signal that something happened, we are stopping vaccination, and that means that before the stopping of AstraZeneca, the Pfizer was stopped twice, but we haven't any reaction, no, such big reaction in Lithuania regarding this. On Astra question, yeah, it happened. Maybe it because at the moment when Lithuania stopped AstraZeneca vaccination, when we received recommendation from our control agency, vaccination of AstraZeneca was stopped for 270 million people in all Europe, and of course media was full of different articles and problems about that. But I am summarizing that I see a problem of culture problem, how we understand the culture of controlling of safeness of any vaccines, not only AstraZeneca, but any vaccines, how we understand and how we hear this process. And in the future, I think we agreed with our state agency that we will continue to monitor as we are doing now, and that the lesson what we should learn from this story is that we should help to healthcare professionals to be more informed, and to report to healthcare system doctors more about the situation, and of course to educate our public. And as I know, in the beginning of this week, I know that our state agency and AstraZeneca issued a lot of recommendations, special letters for doctors with explanation which should help to our patients and to doctors. And I am seeing in the future that we should create a culture. It's a normal situation when we are stopping vaccination. That means that we are working and that safeness is the first. It's a signal. We are evaluating. It's okay. We are continuing. No problems.
Minister, I see a couple of also questions around the vaccines of rather general nature. So basically, I think we all read about vaccination and the plans when this will or can be expected. But if you could give a short comment on how generally the general public can expect the vaccines, and is there anything that businesses can do to help securing the vaccines sooner?
Yeah, according to my news, the situation in the vaccine world is that the private sector, commercial market, will receive maybe only next year the vaccines for commercial possibilities. That only for 2021. All vaccine issuers they have a problem how to produce the vaccines for governments of the countries. It's a problem to solve the problems of contracts with governments. At the moment, what we have, it's okay. What I want to say for Lithuania, it's very important that Lithuania is a very clever state, and Lithuanian government, not only this government, but I am talking about former government, and former government issued clever decisions. We have diversified portfolio of vaccines. That means that Lithuania reserved different vaccines. Our portfolio is full of different manufacturers and with enough quantity for Lithuania. That means that if, for example, AstraZeneca have a problems, for Lithuania is not a biggest problem. We have other vaccines. If Pfizer will have problems, maybe Astra will not have. That means that we diversified our portfolio, and now it's only a question when the vaccines will be there. According to the numbers what we have now, it seems that the massive vaccination should start somewhere in June. It's at the moment it seems that only this month we will have so many vaccines that we will have possibility, but it's according to numbers what we have at the moment. But we have information that all companies now are working very hard to change this situation and to deliver for us more vaccines as soon as possible, and that is good news. There I want to explain what happened in the life of politicians. I would like to explain, because in Europe for coordinating of vaccines is responsible European Commission. It's a coordinated mechanism. They are announcing very ambitious plans. For example, that in the middle of the summer we should vaccinate 70% of people. But it's a fact that manufacturers they are not in time together with the things what announced politicians. And then we have in concrete national state a problem that when we are announcing the fact how many we have vaccines, these facts not correlating with the plans which were announced at the highest level. It's only a problem, but this is not confrontation. You can have very ambitious plan, but the fact what you have is a little bit different. I'm not sure that I answered, but I hope.
Minister, it is, I think, a very hot topic, the COVID situation and vaccination and all related matters. I believe there are, also other spheres, and the implementation plan of measures of the government program has been published. I believe it's quite ambitious. But if talking generally and coming to this, your further or not even further plans, there are quite a number of issues to be solved in our country. So if I can ask, what we see and hear from the companies, that basically innovative treatment can reach Lithuanian, which can reach patients after health technology assessment, at the present moment is quite problematic. The timing is very long. And are there any plans how to speed this up, how to clear this process so that Lithuanian patients can really benefit of the innovations?
Okay, of course, now about 90% of our time is we are spending to COVID things, but we started first of all our few steps regarding the in-pharmacy section, and the draft law on pharmacy concerning the first prescription rule will be changed, and it will be under consideration in the parliament. And the draft law foresees that if a patient refuses to purchase the cheapest reimbursable pharmaceutical which was prescribed for him for the first time, or he can purchase another reimbursed pharmaceutical of the same by paying the patient co-payment. That means that the difference between retail price and reimbursable price, according to the current regulation, patients shall pay the full price pharmaceutical. And these changes, I hope, will ensure better access of reimbursable pharmaceutical as well as better treatment. And it's real fact what now we are doing. Regarding generally, now we finalized a plan of all our measures, and I hope that even we have their problems with pandemic, but our team will start as soon as possible with all other things. And I know that today Danguolė, my colleague, joined me to this meeting, and she is coordinating our all other measures except pandemic. And please, Danguolė, a few words about these two reforms which are the most important, and we are allocating more than 280 million euros for that, and of course about the news about how we are looking to new technologies. Please.
Thank you very much. I just wanted to ask to Arnas and Dalia about HTA, and this is the painful question for us that we inherited from the former government, and since 2020 we have started this more sophisticated evaluation of pharmacoeconomic and also the clinical effectiveness of the pharmaceuticals. Without having very good preparation for this, and we are lacking pharmacoeconomists and the experts, and also the system was not set yet. So we really are lacking human resources for that procedure that we want to follow, and we were expecting to have 8 people to solve on this expertise of HTA, but we have only 1 at the moment, to be honest. So this is a very sharp question, and I have to be honest and open to you. So we are trying now even to look how maybe to decrease a little bit our requirements, or to solve that as soon as possible, because in Lithuania we don't have the legislation that, for example, the money that pharmaceutical companies pay for this evaluation could come back to the pharmaceutical agency that they could use that for those pharmacoeconomists, which are quite expensive ones. So we are trying to solve it, but I don't have the promise today for you. Just only want to say that we know this. In terms of the plan of action, so we have 5 big priorities, and there are plenty of things, and one of them in the personal health care is also related to innovative all health technologies that we are trying to have separate projects in, and we are going to finance them and other measures, other reform projects through our recovery and resilience facility that Minister said about 280,000 euros, and also more than 500 million euros are related to our European structural funds. So we are now under the planning of all those activities.
Thank you. Also, we had a question on what are your plans, and are there any, on how to ensure the quality healthcare for the patients, if you can comment on some of the measures.
If I may, Minister?
Okay, but maybe I will say only a few words before you, Danguolė, that the main signal from our side is that we want to put into a culture of our discussions in the on the healthcare system problems. We want to put one very important additional layer. It means that we should understand that in 15 years period, Lithuania will be the oldest country in EU, according to the structure of our society. And this is a very important message, that all our reforms and all our structure of services should be correlated with this fact, and it's a start for our all researches. And only after that we can discuss about the structure of hospitals, when we will put in our heads the research results about what is situation in different regions in 15 years view. And okay, Danguolė, now please.
About the quality programs, so we want to make special indicators for quality, like KPIs for health services, and we are trying to develop now them according to the different specialities and different profiles of healthcare, like intensive care or nursing or cardiology or whatever, and also how to monitor the quality in healthcare institutions. So this is our goal, and we are trying now to establish working groups that they could develop such indicators for us. And of course, we are going to invest into quality healthcare, also to make the contracts with healthcare institutions based also on a few qualitative indicators.
Thank you. Being cautious of time, I see it's 12 already, and I believe we should be letting Minister you go, or do we have a time for last question?
Let it be for the last question. Maybe this question will be the most important. Maybe it's a key for our meeting. Let's give, and I hope that it's not the last one of our our meetings. Maybe we will have a tradition and we will meet in the future, but we are still waiting this question.
Okay, Minister. So maybe if there are a lot of questions actually in the chat and in that have not been answered, but maybe if I can to summarize on this, the question we received is when and how do you see when the Lithuanian patients will actually get the best treatment for them? Not how do you see in terms of timing, not something which is most cheapest one?
Okay, to be frank, you can't trust any politician if this politician will say that I will solve this problem in the period of my mandate. You can't trust, and I can say that I and my team will put all efforts to build a basement for the changes, because I understand very well how big are systematic healthcare system problems, and I understand and I know how difficult they are. But I hope that we will put a basement, and that will help for future. But for the problems what we see in Lithuanian health system, we need at least, it's my forecast, we need about 10 years. About 10 years for the changes, because we are talking about changes not in infrastructure. We are talking about changes in the minds, in the thinking of, and in changing of people in this system. Now we are we always ready to build a new research center, to buy a new equipment, but the problem is people, staff who is working with this equipment, and we should change a lot of things in how we are using money in this system. We should understand that sometimes we should thought about more money for investment in qualification and competence, but not in infrastructure. And we need a time.
Thank you very much, Minister, for your time, for sharing your views, ideas, and for being frank with us. I believe this is very important for all the business community to understand the true picture. So once again, thank you very much. And I think on behalf of everybody, we could and we would wish you success in implementing the measures that have been planned. If there is anything that the business community can help, or how we could assist in this process, of course, being helpful, not making some difficulties just for formalities here. So please, really, the community is ready to help and to assist in implementing them. Thank you very much.
Thank you. Bye-bye.
Bye. Bye.